should get a booster shot? Will younger kids get vaccines soon? And what is the deal with natural immunity? I'm very excited to ask those questions of my guest today, a person you already know, a true expert at breaking down the science for any audience. Dr. Darien Sutton is, I'm going to read your formal bio, a board-certified emergency physician, medicine physician, medical contributor for ABC News, and I think you might know him as professor at TikTok Med School. You're amazing. So thank you so much for being here.
Thank you. It's always exciting to talk to you because I know that questions that you ask will save me a lot of time later.
Oh, that's so sweet. Thank you. Well, it also saves me time because then you can explain it and I don't have to. And the first one I want to get at is natural immunity. My DMs are filled with people saying they want to get natural immunity now, not vaccine immunity. Would you break down what is this whole concept and why do you think people need to get a shot even if they've had prior infection?
So this has become a central topic of discussion, and I want to start with something short, which is that natural immunity does exist. Now that I've grabbed the attention of the people who are listening, I believe it does exist, but there is a couple of issues with how we identify natural immunity and how we can understand whether or not it's being sustained. And by that, I mean, recently, a study out of Israel had shown that those, and it compared specific groups, those who have been naturally infected, and it looked at their risk of reinfection, and it also looked at those who have been vaccinated and their risk of breakthrough. So it's essentially trying to see who is breaking through versus who is getting reinfected. And we have known since the beginning of this pandemic that someone who has been recently infected, and by that I mean someone who has had a natural infection within 3 months, is very unlikely to have a reinfection. So that already exists. And we also know that breakthroughs are rare. And what they ended up finding was that both of these outcomes are still and uncommon, but those who had a natural infection, especially those who recently had a natural infection, were very unlikely to get reinfected. But there was a third group that, for me, is important clinically, and it's looking at those who have had natural infections and have gotten at least one dose of a vaccine. And it was able to show that that group had the lowest possible chance of a breakthrough infection. So what does this tell me? This tells me that natural immunity does exist. This tells me that natural immunity plus vaccines is probably the most optimal answer. But there are some questions that have not been answered, which is number one, how long does natural immunity last? We know from prior studies that those who have been naturally infected can have variable responses. Some people have protection for a longer time than others. And we also don't yet have a test to confirm what immunity means. And by that, I mean, is it a certain amount of antibodies? It is a specific cytokine or inflammatory marker, or is it something that we haven't seen altogether? So because we don't have that answer yet in terms of confirming immunity, and because we know that natural immunity is variable from person to person, the lowest risk, highest benefit option remains to get vaccinated.
Thank you for that clear answer. You referenced the Israel study, and people keep messaging me saying, well, the Israel study says, and you've explained it. Can you help with one nuance? It's a preprint. It's not a peer-reviewed study. Would you explain the difference and why anybody who's doing their, quote, own research should understand the difference?
So there's some paradigms in medicine that we always abide by, or at least that I was taught by in my training as a physician and as a medical student. It was that you need to make sure that the data that you are using is verified, and you need to make sure that the study that you're looking at can be replicated. And by that, I mean, when we talk about studies and reviews and data, we do this term called peer reviewed. And that essentially means that scientists who have been doing this for their entire career go through the data, they break it up, they figure out what is verifiable, what is replicated, and also questions and relate it to other prior studies. Unfortunately, with this Israel study, it's gotten a lot of traction, but as scientists, we don't really look at it because in normal worlds, we wouldn't really acknowledge it, to be most honest with you, because it has yet to go through that rigorous standard of care that we use for most studies when we're trying to figure out what clinical changes, which should we make for our patients, if that makes any sense.
Yeah, so basically more work needs to be done, and we don't have enough data from that one study. In fact, there are other studies, is this right, that show getting a vaccine is the better call once you've already had COVID? Is that only from the Israel study, or is that evident elsewhere?
We've seen that evident elsewhere, but in studies that has been shown, it's often not the endpoint that the scientist or the scientific group is looking at. And so we gather this information, but we also have to ask ourselves, is this the point of the study, or is this just something additional that we found because of that study? And if it is something additional, then that needs to be investigated further. Science has a lot of different layers of safety and protection, but also to prove efficacy and effectiveness. That's the reason why those things exist.
And just one last question about the natural immunity sort of obsession right now. You mentioned people should get the shot because even if they get a prior infection and get antibodies, they don't know if that's adequate or how long it lasts. Can you also speak to the impact on the healthcare worker community and the possible downside of relying on natural immunity?
There are many people who go, and I even have seen the videos. We've all seen these videos. You know, they're viral, where someone is yelling, "I've already had COVID-19. I can walk around without my mask. I can enter in this establishment and commandeer this space because I know that I have this immunity." But as scientists, we're looking at that person and we're simply saying, how do you know? There is no specific study that confirms whether or not you are immune or you're not. And to be honest with you, thinking that you're going to wait for your natural immunity to kick in, or thinking that maybe I'll get COVID to prevent COVID, these are all high risk options that are not only associated to you as a person, but to the people around you. We know from studies and verified information that those who have been vaccinated are less likely to get infected by 5 times, less likely to get hospitalized by 10 times, and less likely to die by more than 11 times. We also have studies that show that those who are vaccinated have lower viral loads if they do sustain a breakthrough infection and clear the virus faster in a shorter amount of time. With all of that being said, picking to get vaccinated is the lowest risk option you could ever choose than wondering whether or not some treatment that we haven't specifically studied or found benefit in is helpful, or simply waiting to get COVID.
Okay, let's talk about J&J for a minute. So many people who got the J&J shot have been kind of floating out there waiting for word of a booster or what comes next. We now have this study that shows that getting a second J&J shot provides 94% effective protection against moderate to severe disease. So what is the significance of that? And do you think the FDA is going to soon approve a second J&J shot? And would you advise people who took the first to get it?
I'm going to answer this as a physician, but I'm also going to answer this as someone else who also operates on social media. So I know the questions that are going to come after this. The study basically pointed out that those who had gotten an additional dose had higher levels of effectiveness in terms of preventing them from being infected or hospitalized. Again, that data is, although we're always looking at it in retrograde or retrospect, that data is from before the Delta variant became the most dominant variant. So yes, we have to take it with a grain of salt in understanding that this is before a more transmissible variant was aware, or we were aware of that in terms of the population statistics, but it still showed some benefit, which is that the Johnson & Johnson vaccine, an additional dose, likely confers a better level of immunity. And I just want to take a step back and help people understand the science. When we get infected by a virus, we have our immune system that kicks in. Most often, our initial immune system is very naive. They don't exactly know what to do. We call that our white blood cells. You can think of that part of our immune system as kind of mall cops. They know what the threat is, but they may not be fully equipped to handle the threat, so they need to call in more forces. And by forces, I mean our B cells, which create antibodies, and our T cells, which create these specific cytotoxic T cells that eliminate the infection. Now, if your body has never seen the virus before, it takes a longer amount of time to call on that immune response. And unfortunately, in that time, the virus is replicating rapidly, especially with the Delta variant, which we know is replicating at a faster rate than anything. So the point of these additional shots is to get that adaptive immunity, those B cells, high enough to neutralize and stop the virus before it replicates and wreaks havoc on our body. And so we'll continue to see these benefits of getting an additional dose. And the question isn't necessarily if we need an additional dose of a vaccine, because we can't assume that vaccines are going to last infinitely through time. No vaccine does. The question really is, when is the best time? Because we see that vaccines are still proving effective. And by that, I mean of the small amount that have broken through and required hospitalizations and deaths, there is no specific difference that we have found yet between Moderna, Pfizer, and Johnson & Johnson. So it tells me as a physician that vaccines are still proving effective, but of that small percent that breaks through, those are high-risk patients in terms of their age and other medical history, so maybe we should focus on those groups. And then the second question that people always ask me with this is, well, what if I mix and match? Because everyone wants to mix and match, and I get it. You're looking at the studies, you're seeing the differences in efficacy, and our natural human tendency is to go 90 is higher than 80, and 80 is higher than 70, so therefore let me just combine and get the highest level. And I do think that there is likely benefit in mixing and matching. I'm not going to say that there isn't, but the question is, where's the specific data? And the only data that I really have to look at is data from AstraZeneca. And the reason why I compare that to Johnson & Johnson is because AstraZeneca and Johnson & Johnson both have the same mechanism of action, as does Pfizer and Moderna. So we'll likely see data on that coming up, but we just haven't had it yet. And it's probably more difficult because it requires collaboration between financial and pharmaceutical companies.
Right.
And we just know that that is not as easy to do as, dealing with your own group.
So your jury is out on mixing and matching, even though you're not inclined against it. We just don't have the data.
Exactly. My idea is that there's no reason to believe that it causes an increased level of harm at all. My question is, what benefit does it provide to my patient? Because if the benefit isn't clear, then I'm not going to advise my patient to get it.
Do you think that the FDA, Johnson & Johnson has to apply for FDA approval for a second shot. Do you think that's likely to come soon?
I think that Johnson & Johnson will likely apply because in their press statement, they released that it was highly effective. I think that the results of that will probably be a lot more looked at under a microscopic lens. And that's mainly because although the risk is rare associated to Johnson & Johnson, we have seen associated risk of this rare clotting disorder. Of course, it is rare, but I know that that question is going to be brought up because these scientists are very rigorous in making sure that they identify any possible risk. And then the next question is, if we're introducing any possible increase in risk, even though it's rare, is it needed? So we contrast that with the benefit. And likely, to be honest with you, it will likely be that only those who are high risk, meaning their age is over than 65, or if they have an immune compromised disorder, will likely be the main goal of getting an extra dose, if any, is advised. Does that make sense?
Yeah, that's helpful. I didn't realize that. I assume that just because, Pfizer and Moderna are likely to apply for a booster, so would J&J, but it's really going to target the immunocompromised. Let's talk about the Pfizer vaccine. They just released a press statement saying that data shows it's safe and effective for kids ages 5 through 11. But my understanding is there wasn't a lot of data in that press release for outsiders to make an independent assessment. What's your take on the status of vaccinating the younger kids?
I'm really hopeful that this press release translates into real data that we can examine as physicians. I'm really hopeful. To be honest with you, I've become even more hopeful that we're going to have a vaccine for those under the age of 12 after seeing the Delta variant, and it's proven to be more transmissible. Unfortunately, for the first time in this pandemic, I've started to see more and more children come in symptomatic and ill with COVID-19. And while the rates of those who are coming in ill in terms of admitting them or dying is staying the same, so the proportion of people is increasing in terms of infection with those who are under the age of 12, but the percentage of them requiring hospitalization is staying the same. So the Delta variant is proving more infectious, but it's not proving more harmful, if that makes sense. But because of that, because I'm seeing more children, I know that we are introducing more risk into these children's lives, not just from the COVID-19 virus, but also its possible long-term effects. And so that has encouraged me to look for the possibility of vaccines. And I'm hopeful that this data proves to be true, which is that the vaccine is safe and effective. And I believe that it will be because I've seen their initial studies and I understand how rigorous this process is. And so I know that if a press statement is coming out, I know that they likely have the information to back it, but the data will be the judge of this entire sequence and not, press releases.
And is the thing we're going to be looking for when the data comes out is, I understand, trying to measure what are the side effects, how common are they, and then weigh that against how effective is the vaccine in kids, sort of like how much protection does it confer, and then is it worth these risks over here? We don't know that yet?
Yep. So we'll be looking, we don't know that yet. So the three things, and you talked about two of them, are safety. Number one, making sure that there's no rare outcomes that we have missed. Effectiveness in terms of preventing kids from being hospitalized. And the third is immunogenicity. Basically, how high are the antibody levels in these patients that they studied and what they found or what they reported. And I think that they'll give more details about this, is that those who have been vaccinated, the children under the age of 12, had high antibody levels respective to the teenage groups. And so that proves to be that the vaccine is proving that it's working.
And then they said that they think they'll be able to apply for use in kids ages 6 months to 5 years after that. Is that something that's sort of a corporate dream, or do you think that's actually real science could back that?
I think that likely before Thanksgiving, we'll see results of their age groups from 6 months to below 5 years old. I'm just assured that they're waiting because I know that they were required to increase their population sizes in terms of what they were studying to try to identify any possible rare outcome or risk.
Are we looking for myocarditis? Is that the big concern with kids?
It's variable from patient or from vaccine to vaccine. And I will say that myocarditis, which is an inflammation of the heart, is something that we have seen substantially higher in the groups of COVID-19 natural infections. And myocarditis, although it is a rare risk associated with vaccines, if that is your concern of preventing myocarditis, then picking the lowest risk option would be to get vaccinated. I want to start with that because if you're trying to prevent myocarditis, you should get vaccinated because COVID-19 provides a higher risk. But I'm sure that they're trying to identify if there's any possible sign of that. These vaccine studies are quite rigorous. They even talk about patients who were struck by lightning if you look at the original studies. And they categorize that as an outcome. And so when you think about how much effort they put into these studies to make sure that they identify the possibility of any risk, it's so incredibly tedious that it makes me reassured.
Oh my gosh. Do you stay up at night reading these studies?
I have a Google Alerts for my studies, and I read them in the morning when I'm eating breakfast. But luckily, I've never read this many studies in my life. Yes, medicine requires you to read studies, but honestly, to be honest with you, most of these studies are often observational studies, which are relatively simple as a doctor to read. I know that they can seem complicated, but they break them down quite easily. So I enjoy reading them.
I love that you do because it means we don't. We can just ask you the question. Thank you. Why is it that Pfizer is the one that's making all these applications and we're not hearing from, for example, Moderna? Should Moderna people, I know there's no cause for concern. It's just taking them longer. What's up with that?
I think it's just a sequence of time. I know that the FDA has required 6-month studies and they have a specific time parameter that they require before someone submits. And so I know that since Pfizer came out first in the race, the race doesn't change. Because of the time constraints that are applied, it's not as if Johnson & Johnson will catch up to Moderna and Moderna will catch up to Pfizer and Pfizer. These three in the race will remain first, second, and third in terms of their information distribution. So we'll just continue to see that.
Can we talk about vaccine safety broadly? Many people, I should say, on social media will tell me they've heard a bad story about somebody who had a bad outcome. But you're somebody who sees people all the time, and you look at the studies, as you said. Can you speak to the infrequency of bad side effects given how many people have gotten this vaccine? And would we know if there was some crazy, weird outcome from the vaccines, if there were to be one by now?
We would, and I'll just start with history. So in the history of vaccines, we often see adverse reactions within the first 6 to 8 weeks of any vaccine rollout. That's in the history of all vaccines that have existed in life. And that's because of the way the immune system works and the way vaccines work. They trigger our immune system to develop a response. The vaccine goes away and your immune system stays with you. As an emergency physician that works at a large tertiary hospital that's also associated and connected to a large vaccination center, I see everything. I see patients who are unvaccinated with COVID, which unfortunately is the brunt of my work. And I also get any patient that has an adverse reaction to the vaccine, whether that be acute or anything at home, because they all come into the emergency room. And I can assure you from my anecdotal experience, although I'm an N value of 1, the vaccine adverse effects is still incredibly rare. I get more questions from parents and patients who have been vaccinated on whether or not they have an adverse effect, but that's also just simply the question. And I go through the process of helping them to understand why they don't have the adverse effect. And I probably spend more time doing that than I do actually treating any rare outcome of the vaccine.
What do you get as your most common myth?
My most common myth right now centers around fertility, menstrual cycles, breastfeeding. I think that during the process of creating life, whether that be you're trying to get pregnant, you are pregnant, or you're breastfeeding, I think many patients want to make sure that they are the safest in that time period. And we know sociology tells us that pregnant patients are often the most safest in society. They're less likely to suffer from traumatic accidents because they're genuinely just a safer group. But with that being said, the vaccines have proven incredibly effective in protecting pregnant patients from getting hospitalized and dying. And just to help people understand, when I'm talking to patients who are pregnant, the risk of COVID-19 increases with every month of gestation. So while you're pregnant, in your 3rd trimester, you're pregnant, your uterus is very large because you have a large baby in there. It's obstructing or decreasing the capacity of your lungs. Your immune system is also suppressed so that you don't naturally fight your baby in an immune sense. And then also, God forbid you were to get COVID-19, the medications and treatments have to be different because you are now a pregnant patient, so you're high risk. And the simple maneuvers as putting a patient prone, which is something that we do often for patients who are very sick, can't be done with someone with a gravid belly. These simple things we can't do when pregnant patients come in sick. And so it makes me even more concerned and even more of a scary situation when you watch someone who has been trying their hardest to keep safe get sick with a preventable virus. And so I spend a lot of time educating my pregnant patients, especially those early on in their pregnancy, about the benefit of getting vaccinated. And I also talk about some things that we've been seeing. I know that there has been no specific association to menstrual menstrual cycle changes and vaccination. But when I talk to gynecologists and obstetricians, and as you know, my twin brother is one, he says, it is normal to have menstrual cycle changes when you're doing something like getting vaccinated, or if you have stress, or if you're starting a new medication, because it's simply all tied together. So I think it's something that we should acknowledge as physicians when we see changes like this, because otherwise, when we don't, it causes more fear and concern and then leads less people to get vaccinated.
Thank you. Yes. This is what so many of my audience are saying, is that they think they saw a change in their menstrual cycle after the vaccine, but then it got better and things are okay. It's fine. Yeah. They just wish somebody would have said, this is normal, don't worry.
Yeah, absolutely.
Right.
Yeah. And I think giving those precautions whenever you're doing anything outside of COVID-19 is really important. Even a simple thing as ordering a test. You have to explain to the patient what that test is going to produce, what the results are going to look like, or else you're like me, you're sitting at home reviewing the numbers and trying to figure out, wait, why is that 0.5 off? Does that mean I'm going to die tomorrow? These are questions that need to be answered. Otherwise, you leave people in suspense, which is not good.
So I just want to ask you about your daily experience, because we keep hearing anecdotally that what doctors are seeing in the ER now are almost entirely unvaccinated COVID patients. Does that track with your experience?
That tracks with my experience fully. And also, I will have to say that the majority of my patients are unvaccinated and people of color, which makes this an even more personal experience for me, because I'm watching people within my direct community, even people within my family, who continue to see a lot of this misinformation that is shared. And I understand it's a little bit different as a person of color. And I'll say this because we already have a baseline of mistrust with the medical healthcare system because of past and present trauma for some. And so it makes it even more of a difficult circumstance. But as people of color, we're more likely to live in densely populated communities. We're more likely to ride on public transportation. We're more likely to work in front-facing positions. And we're more likely to live in multi-generational homes. All of these reasons increase our risk for getting infected with COVID-19. And then we're less likely to have clear and competent access to healthcare. And so I'm seeing that every single day, where the conversations I'm having with patients about the benefit of a vaccine is often the first time that patient is having a discussion with a physician. And for me, it makes me realize that there's a fundamental issue within our healthcare system that we have not addressed and we continue to kind of ignore, to be honest with you. And it leads to more death of people who look like me.
Well, I'm so glad you're there, having the conversations in the hospital and here with us. Thank you endlessly for your time, and also for the information you give me when I DM you saying, I don't know what to say to this. Thank you.
I enjoy it. It's these questions. Your questions are always the best, because I kid you not, I'm going to use this and say, just watch this interview, and then people can leave me alone. Because it really, many people want to talk about headlines, but these are the questions that people DM me about constantly. So I'm glad we're doing this now.
Thank you so much. Hi, I'm Jessica Yellin. If you like this video, please click subscribe, and you can click the bell to get notifications when we post new content. Thanks for watching.